live. Late night physical therapy on an adult barred owl. This is a physical therapy that's taken a while. This one's got a humerus fracture. So what I'm doing right now is just doing some nice extension on the wing, trying to maintain the soft tissues. So this wing here, it's a challenging surgery on this one. This one, it's this upper wing or upper arm bone, the humerus, and this one was shattered in a lot of pieces, so I wasn't able to get it as stable as I would like, and because of that, it's got a ton of swelling. I'll show you guys. I'll see if I can move the camera and show you guys. This barred owl is very, very fluffy. I'll grab the camera real quick, flip it around. Forgive me, I'm not normally a social media person, so here we go. So you can see right here, you've got, this is our anesthesia machine. It's coming to the owl, so the owl's breathing and anesthetic. And while I'm doing this, I'm keeping an eye on how it's breathing. You can watch as its keel moves up and down. So anyway, this is its normal wing. You can see how big the feathers are, but the actual amount of bone and everything is very kind of small comparatively. They don't have a lot of tissue. But on this side, you can see there's a lot of swelling. You can see there's a lot of bruising. That is very typical for a fracture like this that's relatively recent. So all this bruising here and edema. We're doing physical therapy to extend the wing. And basically try to get this swelling to go down while also maintaining the range of motion. And what I mean by range of motion is making the broken wing extend the same way that the normal wing is. You know, when they're flying, you don't want to have any kind of asymmetry to how they're flying. And this particular wing, the right wing that's broken, normally you want it to get to about 145 degrees between the humerus and then the radius and ulna. That's about normal extension. This one we're only at about 120 right now. So we're working to get it better and better. And if you're ever in doubt, you can always do the normal wing. So this is a normal wing here. And again, every now and then I'm taking a pause to watch the breathing. Nice, good breath. This owl had surgery about, about a week ago now. When it came in, it was really, really sick. Had been hit by a car, so it had head trauma. So when they're flying, you know, they're flying head first, and a lot of times the brain will get rattled around. And this one also had some internal trauma too, so it wasn't breathing very well. So once we got it stable. Then we did a full anesthetic procedure, right? And then we under full anesthesia, and that's how we were able to do the surgery to fix this. So it actually has a metal pin that's running up inside the bone right now, and that's what's stabilizing the fracture while it heals. If we didn't do that, the pieces, imagine my arms are pieces, they would slide past each other. And it would heal with either the wing being too short or being angled in a weird way. I was saying earlier, this particular fracture, I wasn't really happy with how we were able to get the pieces to come together because they were kind of challenging pieces. There was a lot of pieces, and some of them were kind of shaped different ways. So it's a little bit of a puzzle when you're doing an orthopedic thing to get everything to come together. So again, here's the face in the mask for those who hadn't seen. Go into the anesthesia machine. This is our normal wing here. So you can see how beautiful those feathers are. Nice, beautiful extension. Thankfully, this wing didn't get injured at all. And then this one, let's see if I back up a little bit. Pretty good extension when it comes, this is the wrist right here, but not this elbow. For those who didn't see, this is a lot of bruising and swelling there. And that's what we're working on. We're working on getting that elbow basically to have good extension. And I'm doing this under anesthesia. mostly because there's some pain involved, but also because it's much lower stress for the bird when we're actually doing this extension and working with these animals. They're, you know, to them, I'm a predator, and so to be going through this lengthy process, it would be very high stress for it to be awake while doing this. This is a regular thing we do at WildCare. We do it a few times a day during our really busy times, but certainly multiple times a week. This one gets it about every 2 or 3 days right now because the extension's not good. And once the fracture is a little more stable, we'll stop doing the physical therapy and we'll allow the bird to do its own physical therapy. The other thing I'm going to do is I'm going to put a warm compress on to kind of help relax the wing. And so I'm doing some extension and then letting it go. Extension and then letting it go. That way it's kind of like when we stretch, you know, you want to get the muscles, tendons, ligaments, everything stretched out. Let's see. Let me know if you have any questions. Again, the whole time watching the breathing on this bird. This is a species of owl called a barred owl. And the reason they're called that is because they have these nice barred patterns on their feathers. So they've got some really, really pretty feathers that really, honestly, when they're up in a tree, they're super well camouflaged. You can see this, I got its little feet wrapped up, but they have really big talons for catching prey. Barred owls will eat just about anything they can catch. They'll eat frogs, they'll eat crawfish, they'll eat little birds, they'll eat rodents. They're really awesome to have around. We have a lot of them here in Oklahoma. All right, I'm gonna put the phone down again. We're gonna do the physical therapy again on the wing. So again, warm compress. It's just a rice sock that's been in the microwave. So now I'm going, oh yeah, we're getting better extension. For those who hadn't heard what we were doing, we're doing physical therapy on an adult barred owl. This one has a humerus fracture. So this bone, basically, same bone they have, or that we have is what they have. Normal wing on this side, normal extension. This side, not normal after the injuries. So we do physical therapy, and then I'm going to hold this one for a bit. Usually we'll kind of do like 30 seconds on, 30 seconds off. And we're just working towards getting normal extension. What is the prognosis regarding the brain trauma? That's an awesome question. At this point, really good. Early on, when these birds get hit by cars, it can be a bit questionable, and we usually end up having to see a lot of times when they get head trauma, they also get eye trauma as well, and they need good vision, decent vision to be able to hunt. Owls rely so much on hearing when they're doing their hunting. Thankfully, this one only had a little bit of mild eye trauma, and now it acts very normal. So I think the brain trauma actually has resolved at this point, which is good news. The biggest concern I have now is how much usage of this wing it's going to have long term. So prognosis is still, I would say, kind of guarded. It may be fair at this point. The fact that it's kind of made it through the first few days, usually the first 72 hours or so for most owls is the time that's most challenging, and when most of them pass away despite treatment. So again, we'll do another extension here. You can see the feathers coming out. All right, we're making good progress. So again, I'm going to flip it around so anybody who's recently joined can see we're doing anesthesia on an adult barred owl. You see how pretty their feathers are. So that's our normal wing there. This is the wing we're working on that has a humerus fracture. Normally we do this physical therapy earlier in the day, but this one, it was just a busy day. We just had a lot of intakes coming in, but it needs to be done today because the extension on this poor wing is not good. So for those who hadn't seen, again, we've got a lot of bruising, a lot of swelling. They bruise and they get tissue swelling in response to injuries, very similar to what we do. And then we basically right now I'm doing the physical therapy as if you were going to go to your own physical therapist. The difference being that we do this under anesthesia, whereas in human medicine they don't do it under anesthesia. The reason being there's some pain associated, and there's also going to be some stress associated because it's an adult owl. And we're getting close. We're almost to what is normal extension. And then once it's at normal extension, we're going to put on something called a body wrap, which basically holds the wing against the body. And that way it's not going to be moving the wing. In its crate right now, it's on what we call cage rest, where it's the owl is in a crate while the fracture is healing, and we kind of go through these different milestones before we eventually remove the metal pin that I was discussing earlier that we put in. Once we remove that metal pin, then we allow the bird to go to outside enclosures where it's going to fly before it's released. So glad your organization exists. Oh, thank you very much. There's a lot of great organizations like us, like WildCare around the country. There's a lot of international ones as well. We see about 500 to 600 raptors a year, raptors being owls, hawks, but the most common one that we get are Mississippi kites. They're not back in Oklahoma yet, but these barred owls, like this adult here, they're here year round. So we always have at least a few barred owls in care at any given time. Oh, we're getting real close. We're doing much better on the physical therapy on the extension. When I first started the physical therapy on this bird, the extension was only about maybe 90 or 100 degrees. We want to get it to about 145, 150, which is what I'm kind of mimicking for you. So as the fracture is healing, the tissues are going to scar down and prevent that extension from being normal. So we have to make sure we're doing the physical therapy at the same time as when the healing process is occurring, so that way everything doesn't scar down and you lose that range of motion and usage of the wing. Oh yeah, making good progress here. All right, for anybody who's just recently joined us, we've got adult barred owl. And we're watching its breathing the whole time, watching its breathing. Okay. All right, we're going to do one more extension. One more set. And then we're going to put on the body wrap we were just talking about. These birds are actually shockingly small when you actually have them in hand. They're very, very fluffy, so they look bigger than they actually are. One more. Great. All right. I did give this bird some pain meds before we did this. And thankfully it's not reacting at all, so I think the pain meds work, which is great news. We don't want our patients to feel pain. They experience pain the same way humans do. So we actually use a lot of the same drugs. All right, so the body wrap process, let me see if I can move everything around a little bit here. So the body wrap process is where we're gonna tie this wing to the body, so while it's cage rested, it won't be using the wing, hopefully. We don't want it to use the wing just yet. Eventually that's our goal, but the healing process for a humerus fracture like this one, usually you're looking at least 8 to 10 weeks in human care. That includes time, surgery, time in the flight cage, doing some flight exercises. So this bird, before it actually goes back to the wild, will have at least 2 or so weeks in a flight cage where it can build up its flight muscles again and get exercise before it has to go and hunt on its own. They're very fluffy, so I'm working to keep from getting a bunch of the fluff in the actual tape. I use a special tape called silk tape against the feathers, which is easy to take off the feathers. And we're going to put another tape over top. Can't tell how much you guys can see. No, I don't like that one. We want to make sure when we're putting it on that it's at the right tightness level. Obviously the bird needs to be able to breathe with this thing on. But we don't want it to be so loose that the bird can get its wing out of the wrap. That would defeat the purpose. All right. All right, so now we're going to turn off our vaporizer here. So this is our inhalant anesthetic. So now we're going to go through the recovery process of the bird. So this is the part that we watch really, really closely. Make sure they're okay. I'm not here by myself. If I need help, I'll holler at somebody. All right. Let's see here. So now we're at the recovery stage. These are warm rice socks, so put that around it so the bird can maintain its temperature. Do some not adjust to being caged at first? Yes. It is definitely stressful for them almost the entire time they're in human care. Because to them we are predators. Some of them will definitely adjust better than others, and they definitely have different personalities, even amongst the same species. So we get a lot of we get a lot of barred owls year round. We get about 50 to 60 of them. And it's amazing how much personality they have. Some are very vocal, some are very quiet. This one likes to see es un bujo. Really like to kind of yell at you. Some of them clack their beaks as kind of a warning to say keep away. Or you can see while I'm recovering the bird, I'm holding its feet. This particular thing is sometimes painful. This bird did not react, so it meant that our pain meds were working well, which is always good. But I wrapped the feet so that if it ever were to reach out, it's not going to grab me, and I'll show you guys its talons here in 1 second. Really, really nice talons. You can see it in relation to my fingers there. Very impressive. Oh, now we're moving. All right, so we're going to go upright. There we go, Kiki. All right, so then I'll turn so you guys can see. Whoop. There we are. So now we sit with them because the recovery process is definitely a thing we have to closely manage and watch. So I'm going to keep some oxygen flowing by the face of the owl while it's recovering. Yes?
Hi. The mallard has dropped in weight the last 3 times that we've weighed her.
Oh, yeah.
The last time that I did her on Tuesday, she definitely ate, and she definitely ate today as well.
Okay.
Do you want to try deworming?
Yeah, let's do that. Let's weigh her daily too.
Okay.
We'll see. We're talking about another patient. We have we get everything here at WildCare. We get over 230 different species a year, which is pretty fantastic. Barred owls are one of our common year-round ones. But we were just talking about a mallard. We have a few mallards here and a few other ducks that have different injuries. We also raise up babies. All right, I'm going to go ahead and turn the oxygen off now. But so get some nice sleep in. So you can see the body wrap. So it's holding the wing against the body. Yeah, you can see some awesome talons indeed. Yeah, Mary. So you can see this is the normal healthy wing. So this one we did not wrap because we want the bird to be able to use it for balance. Here you can see the talons. So you'll see I'm holding the feet because even a bird that's this small relatively can still really hurt you. And they have these big talons to grab prey, and they eat anything. These barred owls will eat anything. They can eat amphibians, they can eat crawfish, other birds, rodents, reptiles, pretty much anything. They're pretty awesome. They can live in all kinds of different habitats. They're cavity nesters, though, these barred owls are. So the special thing for them is they need to have a hole in a tree, basically, to nest in. And we're also at the time of year right now where they're having their babies, and the babies are sometimes jumping out of the nest. So we do a process called renesting. So we'll put the babies back up in the tree or somewhere where the parents can access them and continue to feed them. Right now we're still very sleepy, and we're in the middle of recovering. The owl needs a kiss on the head. Yeah, I try not to kiss them. It is a wild animal. This is the one time where I kind of get to really sit with the wild animals. It's really the only time where I'm ever able to do this in kind of a relatively low stress way for them. This bird is still obviously sedate, and it's coming out of its anesthesia. How you doing? It did get some pain meds before this too, so it'll still be a little sleepy from that. We're going to end up putting this one back in our ICU. This one's going to stay in the ICU for a little bit longer. And then hopefully we'll move it out to an outside enclosure that is where it's going to be away from us for most of the day, but that way it can be lower stress, but it'll still be rested in a way where it can recover from its fracture. So for anybody who's joining us, we're recovering a barred owl that has a humerus fracture. It's recovering from its anesthesia and physical therapy that we are doing. This one was hit by a car and had some head trauma to begin with. Now, head trauma for this guy was a little bit of eye trauma as well as some brain trauma. That has thankfully seemed to have resolved so far. But the thing that we're working on now is recovering from this humerus fracture. And as I was saying earlier, it's a pretty long process for these guys, just as it would be in a human. It can be anywhere from 8 to 12 weeks, sometimes longer. Basically, they've got to heal the fracture, and they've got to get reconditioned and become athletic enough to survive on their own in the wild. You ready to go back in your crate? No? Oh, you've opened an eye at me. So we'll just sit here. You can see the eyes are kind of opening now. Cute little face. Cute little face. This is one of those species that, as an adult, They don't even kind of look real. They're just very, very, very cute. You ready to go back? All right, well, thank you all for joining. Owl's going to go back to our ICU now, and we'll leave it a nice, tasty meal for the night. This one's been eating really, really well on its own. It's still on some pain meds, so it'll still be sedate for a little bit longer, but it'll go back to our ICU and continue its recovery. So thanks so much for joining. Have a good night, everybody.